This is an example of a heart with an artificial aortic valve. Please notice the thickness of the left ventricle here on my right hand. There are two types of replacement valves: mechanical valves and bioprosthetic valves. Mechanical valves are metal or plastic and have different forms, such as a ball and cage, as in this case, or tilting discs. These artificial valves require lifelong anticoagulation. In contrast, bioprosthetic or tissue valves consist of animal tissue, usually from pig, and do not require lifelong anticoagulation. Tissue valves have a more limited lifespan than mechanical valves. Complications of artificial valves include thromboembolism, infective endocarditis, and structural deterioration of bioprosthetic valves. An inherent risk of lifelong anticoagulation is serious bleeding, with hemorrhagic stroke an important complication.